Here's a detailed overview of Alteplase, tPA. Chapter 1. Generic name, drug class, brand name. Generic name, Alteplase. Drug class, thrombolytic agent, fibrinolytic, tissue plasminogen activator, tPA. Brand name, Activase, cathephyl activase, for catheter clearance. 2. Definition. Alteplase is a recombinant form of human tissue-type plasminogen activator used to dissolve blood clots in the treatment of acute ischemic stroke, pulmonary embolism, and myocardial infarction. 3. Mechanism of action. Alteplase binds to fibrin in a thrombus, blood clot, and converts entrapped plasminogen to plasmin. Plasmin breaks down fibrin and dissolves the clot, restoring blood flow. 4. Indications. Acute ischemic stroke, within 3 to 4.5 hours of symptom onset. Acute myocardial infarction, STEMI, pulmonary embolism, massive PE with hemodynamic instability, central venous catheter clearance, cathephyl activase. 5. Contraindications, active internal bleeding, history of recent intracranial hemorrhage, known bleeding disorders, recent major surgery or trauma past 14 days, severe uncontrolled hypertension, intracranial neoplasm, AV malformation or aneurysm, recent ischemic stroke, within 3 months for MI use. 6. Before taking this medicine, precautions. Review medical history for recent surgery, stroke, trauma, or bleeding disorders. Check blood pressure. Uncontrolled hypertension is a contraindication. Lab tests, platelet count, PT-INR, APTT, and bleeding time. Use cautiously in elderly patients or those with high bleeding risk. Pregnancy category C, use only if benefits outweigh risks. 7. How to use. Administered intravenously IV in a clinical setting, hospital emergency, cathephyl activase is instilled directly into a blocked catheter. Dosage and administration depend on the specific indication. 8. Dosing information. Ischemic stroke, 0.9 mg/kg IV, max 90 mg, 10% as bolus over 1 minute, remainder over 60 minutes. STEMI, accelerated infusion, 15 mg IV bolus, then 0.75 mg/kg over 30 min, then 0.5 mg/kg over 60 min, max total 100 mg. Pulmonary embolism, 100 mg IV over 2 hours. Catheter clearance, 2 mg 2 milliliters instilled into catheter and allowed to dwell. 9. Miss a dose overdose. Miss a dose, not applicable, as it is given in hospital as a one-time dose. Overdose, risk of severe bleeding, requires immediate medical attention. Administer antifibrinolytics, e.g. aminocaproic acid or blood products if needed. 10. Stop or avoid taking. Stop or avoid if signs of major bleeding occur. Intracranial hemorrhage is suspected. Patient develops hypotension, severe allergic reactions, or anaphylaxis. 11. Side effects in detail. Common, minor bleeding, gums, nosebleeds, bruising at injection site. Serious, intracranial hemorrhage, gastrointestinal bleeding, hypotension, orolingual angioedema, reperfusion arrhythmias, anaphylaxis or hypersensitivity reactions. Note, bleeding risk increases with age, concurrent anticoagulant use, and recent surgery. Vital information. Time sensitive, most effective when administered early, within 3 to 4.5 hours of stroke. Always confirm CT scan of brain to rule out hemorrhage before use in stroke. Requires close monitoring of vitals, neurological status, and bleeding. Number 13, other drugs will affect Alteplase. Anticoagulants, e.g. heparin, warfarin, increase bleeding risk. Antiplatelet drugs, e.g. aspirin, clopidogrel, additive bleeding risk. NSAIDs may increase bleeding. Recent thrombolytics, risk of cumulative bleeding. Thank you. Have a nice day.